Samba
Yaw.
Canada. All right. Good day, everybody, and hello, and welcome to our second SA Lifestyle Medicine Spotlight. My name is Dr. Dumi, and I'm so honored to introduce today Dr. Samba Yaw Nyirenda, fondly known as Samba. Dr. Samba is a trailblazer in lifestyle medicine in Botswana, with decades of experience in healthcare, public health research, and clinical practice. After years of service with CDC Botswana in TB and HIV research, in 2016, she established Sarai Holistic Sick Care, a lifestyle medicine general practice in Francistown. She holds dual certification with the International Board of Lifestyle Medicine, first as a diplomat in 2022 and later as a physician in 2023, becoming one of the first in Botswana to achieve this distinction. She also chairs the steering committee for the Botswana Association of Lifestyle Medicine and is a proud member of the SA Lifestyle Medicine Association. Welcome, Dr. Samba. Thank you for joining us today.
Thank you for having me. I'm thrilled to be here.
Thank you. So, as the first part of our segment, we really just want to get to know you, Dr. Samba, and share some light on some of the work you've been doing. So, you've had such a remarkable journey from infectious disease to research to leading lifestyle medicine in Botswana. Could you share with us what inspired this transition and how Sarai Holistic Care came to life?
Okay, thank you. Thank you for asking. Yeah, so I guess after decades of working, and as you mentioned, for the CDC Botswana in tuberculosis and HIV research, when I was now ready to start my own private practice, I wanted to do medicine in a different way. I realized that the conventional approach we had was really not holistic enough. We were just like treating symptoms, for the chronic conditions. We were just treating symptoms, and I just wanted to offer something that was different. I didn't know anything about lifestyle medicine then, but I just had the vision to, just offer something that was different to the community. And, as they say, when the student is ready, the teacher arrives or something like that. So along the way, lifestyle medicine found me. And I just fell in love with it because it just made so much sense. The evidence base was there that all these chronic conditions, which we were treating as though they were acute conditions to be just diagnosed, give specific treatment, antibiotics, whatever. We were doing the same with the hypertension, the diabetes, and all that. All these, which were evidence-based to be chronic condition related to our lifestyles, which were factors we could influence, we could change. And that even if there was a genetic predisposition or whatever risk factors, we could mitigate that just through the lifestyle changes that we put into place. Yeah, so that was thrilling for me because it was about empowering.
Definitely.
Yes.
Sorry, I think I lost you there for a second.
Came to life and what we do in Sarai Holistic Care. Yeah. So over the years.
So tell us more about what you do at Sarai Holistic Care.
Right. Thank you.
I think we have a delay. Yeah. Sorry.
Yeah. No problem. That is a technology that we work with. So over the years, I have learned more, and we have developed more, and I'm able to deepen what I offer through all the trainings that I've had and the certifications, so that today, even as I am basically a general practitioner, but being certified now in lifestyle medicine, I do have the skills and tools to offer much more to each patient encounter that I have, in terms of, basically asking them permission to look at their lifestyle, whether they're coming for a headache or a diarrhea or whatever. if you're walking into that clinic, I ask permission to say, please, can we talk about your lifestyle, so that whatever it is that's going on, we can start to look and to see what are the things that we can improve, we can mitigate about whatever conditions we may be living with or not be living with, but we may be at risk for them because, there's family history or whatever other things. So I've also in these years become very passionate about mental health and just general wellness. And I've also become certified as a mindfulness-based intervention facilitator, so that I use these other extra tools of the power of mindfulness to be able to help people to better just be with what they're experiencing, and perhaps work better with some of the habits we may have around anxiety, maybe overeating, etc., instead of just having to go straight to medications for everything that comes along.
Wow.
So it's combining, and it is one of the pillars of lifestyle medicine.
Wow.
Yeah.
That's great. So you ask people about lifestyle and you are actually equipped to be able to support them. So I think that makes it a practice that shines out amongst the rest. So you really are pioneering lifestyle medicine in a very unique context. What are some of the specific challenges and opportunities that you see in applying lifestyle medicine approaches in Botswana and the broader African settings, as we know you're involved with so long, and South African Lifestyle Medicine Association?
Yeah, indeed. Yeah. So one is, when we actually get to explain what the lifestyle medicine pillars are and the evidence-based, one can see that it is so intuitive and it is so much going back to the African traditional roots. But it's like this is a truth that is hidden in plain sight because we've become so caught up in the prescription, in giving prescriptions, more medications, more procedures, etc. So there is a great need to be able to begin to shift that mindset. And one of the great challenges is the amount of time that one needs to spend if one is to really practice lifestyle. My consultations usually take about maybe an hour, especially if it's a new patient, they take long, And I'm aware that for many practitioners in whatever domain, they may not be able to have that kind of luxury of the time because, there's so many other priorities that they need to be able to sort out, and especially in our public health services with the long queues and congestion. So unless we can integrate it and make it a part of everyday care, everyday practice, everyday encounters, little moments when we talk about lifestyle, because it is there in all our guidelines, whether it's hypertension, diabetes, whatever, usually the first thing is they say lifestyle, and then the medications. But how many of us know how to offer that? How many of us have the time to actually ask about these things? I remember before I knew better, I would gently suggest to somebody that, before I that, you need to increase your exercise, whatever. And then they come 2 weeks later and they say, doctor, my knees are killing me. And I say, what happened? You say, I went jogging. And I said, oh, what happened? Why did you go jogging? This is somebody 90 kg who never even walks regularly. So, but you said I must exercise. And then I know, my goodness.
Yeah, there's a way to prescribe this, and that's why we do this training. Yeah.
So since then, I have learned better. So I will give them their script for whatever medication, whatever, and then I'll do another lifestyle prescription that we agree upon, that, okay, what are you willing to do? What are you able to do? What do you like to do? Okay, they say I want to do, I said, okay, could you start with maybe 20, 30 minutes, 3 times a week? Does that sound okay? Yeah, I could do that. And then, okay, when will you do it? What time? So we actually write out that specific prescription for the movement, and then something for the food, like, could you increase the green leafy vegetables by 1 cup? So slowly. So I'm working with them, and I'm helping them make the changes they are ready to make step by step at whatever stage that they are in, which was something I didn't know before lifestyle medicine.
Yeah, that's amazing. So it's just about shifting our mindset, shifting it that this is going back to our traditional African roots, living this holistic lifestyle, medicine type of lifestyle. And us as healthcare professionals in Africa need to start shifting our mindset and learning these tools that you've gained as a lifestyle medicine practitioner to be able to meet your patient where they are. So thanks for that, and it is definitely an opportunity, and not only a challenge, but an opportunity for all of us to improve ourselves. So yes, you've mentioned it a couple of times, and we know you're deeply passionate about mindfulness-based interventions and stress resilience and whole food plant-based nutrition. Could you share how you integrate these into your clinical work and community programs?
Okay, so the mindfulness-based interventions, especially when people are presenting with a lot of anxiety and what stress, as we call it, etc. So many times they may be, I think many times they may just want to be heard, really, but sometimes they're looking for maybe a pill or something, or it's even like insomnia, can't sleep, etc. So just taking the time and asking permission whether we can look a little bit into what's going on, and learning to recognize the thoughts, like screening with GAD-7, generalized anxiety, generalized anxiety disorder scale 7, just to find out how much that's affecting them, and then offering them as there are some mindfulness-based apps that I have also been trained to use, that I can offer them as support with that, that is to better to be able to recognize that our feelings, whatever, there are things that will come and go. We don't always have to act on them, and we don't have to medicate them. So what is it like to just to be able to be with, that anxiety? Where am I feeling it? Where am I locating it? Instead of trying to fight it or fight the person whom we think is making us anxious, just taking care of ourselves that way. And this is where even for the eating, it's so important, because many times when we are overeating, it can be an emotional kind of a thing. So just recognizing, what do I really need right now? Do I really need to eat that food, or do I need to take care of myself in some other way? So just learning to take little pauses. I must confess, when I started integrating these mindfulness-based things in the practice, at the beginning, I used to think, oh my goodness, because when I'm just sitting here without an agenda, just listening to what this person is saying and just trying to be present for them, am I going to lose it here? Am I going to forget my differential diagnosis? Because, the training, I don't know about you, but had been, as soon as they're walking through the door, you start sizing up and having an idea what could be the differential diagnosis. We're already ticking boxes, putting in boxes. But then what is it like to be with somebody without any agenda at all, just to be there, just to listen to them and be with them? And that is so liberating, because that medical knowledge doesn't go away. It's still there in the background. But I've listened deeply, and other stuff comes up that may not have been obvious had I just been following an agenda and wanting to have the answers that I thought I needed to have to write my prescription and send them on their way. And many times they'll also say, I felt I was listened to. I felt you heard me today. And many times they may have come wanting some kind of medication, and they're happy to go away without any for that particular day, just to try to make little suggestions. Yeah. So I'm not sure if I've answered that. And sorry just to go back a little, I may not have answered the previous question fully. The other thing I want to say is that right now we have a lot of challenges with medications and resources in Botswana. We've run out of money for the medication and resources. And to me, this makes it even more urgent that we could look and see how can we reduce the burden of people having to depend on medications, the number of medications, the doses of medication, by empowering them to look at their lifestyle and to change their lifestyle so that they do not need so many, or they can reduce the chronic medication burden. Yeah, so to me, it's a very urgent thing. Yeah.
Yeah, a solution to a real life problem, and that would be lifestyle medicine. I think the part that we didn't get into was about your interest in whole food plant based nutrition, from your food for life instruction,
Okay.
coaching, and the projects that you're coming
Okay.
up with soon that's related to food.
Okay. Right. Okay. So yes. So in this lifestyle medicine journey, it's been very interesting because I came to see that many times the patients may know the how, they may know the what and the why, what's this and why should I eat this, whatever, but how to put it together did not always seem to be clear. And I would spend a lot of time giving little tips of how to cook so that the food is healthy, because the understanding was always that healthy food is boring. You just boil, you just boil it. Or when I say, consider eating more vegetables, it will say, oh, broccoli is very expensive. And I'd say, but who said broccoli? I'm talking about moroho and cabbage. So when I found that there was the Physicians Committee for Responsible Medicine were offering this the food for instruction training to be able to actually teach people how to make healthy, delicious food, I thought, okay, this is what I want to be doing, because I love cooking, I love eating. Yeah, and I love sharing delicious recipes and foods with people. And sometimes I would have baked something, I would have had something, and I'd have it in the kitchen, in the clinic fridge, and then I'd give them a sample to taste, like an apple, a biscuit that I've made from like maybe carrots and oats, and just
Oh,
raisins and
yummy.
dates. Yeah, with no milk, no eggs, no sugar, and but this is nice. So yeah, of course it is.
Yeah. So have you had your opportunity to teach people how to prepare food? And can you tell us about these upcoming events and courses that you'll be hosting?
Yeah, so I've started the Food for Life. I just graduated recently, and I started my class, and we've done about 3 classes. So we've been doing them at the clinic every Saturday. There are 2 hours. We follow a curriculum. There's a video of a teaching, usually by Dr. Neil Barnard and some other clinicians. Then there's a quiz, whether true, false, whatever, and a discussion around that. And then after that, we have a cooking demonstration, and then we get to sample. We get to sample what was cooked. And then, of course,
Very
it's a time
nice.
and people have been amazed at things like being able to cook without using oil, just.
That sounds like a special skill.
And then yeah, and then just, and then while we're doing all that, so emphasizing the different, for like when emphasizing the nutrient benefits of the different foods, which one, how certain foods will promote protect us against the cancers, and the importance of fiber. And then we discuss things like, learning how to read labels, and then, facts about soy, and, all this, depending on what the focus is. So really, and, people being offered a chance to go and see what is it that you might like to try to change, to be different. So they have been very interesting. It has been a lot of fun. I'm really, really enjoying that. Yeah, right. And I'm also doing a culinary course through Solong, the Nigerian, of which Nigerian lifestyle medicine center, of which I'm a member as well there. And then I just discovered that there's this one that the American College of Lifestyle Medicine is offering a free one. So I was on that. So I'm really, really enjoying being a culinary doctor, so to speak, because I think the how is so important, at least for me at this stage of my life. The how of to make food delicious is so important. Yeah.
That is so true. I hope you can make us some healthy jollof rice one day.
Yes,
Yes, it's just so we
for
can
sure.
know that our traditional food can be prepared in a healthy way.
Right.
Culinary medicine is really the way of the future, and hopefully we'll see it in medical schools one day as well.
Yes, that would be awesome. Yeah.
So, just before we wrap up this segment, Samba, you've been really involved in the Botswana Alcohol AIDS Project. Would you like to talk about that, in terms of the 6 pillars of lifestyle and how risky substances is an important pillar that needs to be addressed, and especially within the sub-Saharan African context?
Okay, so that was something that the Botswana Alcohol AIDS was something that was way back. That was way
wasn't
back.
it this day? Yeah.
Yeah, that was way.
Yeah.
But now, it was something that was way back with my late husband, just creating awareness around our alcohol and how it might have had a role in the HIV epidemic, etc. And then there was a counseling center with my late husband, who was an addiction specialist. So so that was then. But I have continued that interest in addiction and mental health as I continue now in Sarai Holistic Care. And right now, the question was how the pillars fit in with.
Just to touch into that, because it is something that lifestyle medicine is a solution towards. But we can wrap up on this part of it, because now I would love to get into the next part of our segment, which is on the case study presentation. Thank you so much, Dr. Sarai, Dr. Samba, for telling us all about Sarai Holistic Care. You are Sarai Holistic Care, and that's how we see it.
Yeah, it's actually named after my late mother. She was Sarah, but everybody called her Sarai. And I started it. She was still alive there, but I started it in her honor. She was one of those colonial midwives. She graduated as a midwife way back in the 50s in Tanzania, long ago. Yeah. So that was a tribute.
Graduated in the 50s.
As a midwife.
Wow.
in Tanganyika.
And she believed in holistic care as well.
Yes,
I'm sure she's very, very proud of you.
Yeah. Okay.
Hello and welcome everybody to this week's SALMA Spotlight. Today we've got Dr. Samba Nyirenda, and we are discussing our lifestyle medicine ward rounds. Dr. Samba is going to be presenting to us a male patient, Mr. AD, who came to her and was treated by her using lifestyle medicine. I look forward to hearing more about this case. Welcome, Dr. Samba.
Thank you so much, Louis. Glad to be back. Okay, so hi everybody. So Mr. Eddie is a 65-year-old male, and he was just starting a new business. So he came to the clinic because he was concerned about bad backache, low backache, and upper backache, always felt fatigue, had painful joints, and was also concerned that in the family there was history of diabetes, and he wondered whether he may be at risk for that, and he didn't want to have to go on medications for diabetes, possible diabetes. On assessment, on the biometric assessment, the weight, when we started off, the weight was 99.7, and the BP was 118/65, got good numbers. His HbA1c was 6, and the BMI 39.4, so almost 40. And so at that particular time, he was not on any medications, no on any other kind of treatment. In assessment, we noted that there was he felt he was very stressed because he was just starting a new business. He was married with 3 adult children, was living with his wife, and there was a son. And he was HIV negative, not on any chronic medication, as I've said. He'd had past surgery for benign thyroid nodule being removed, laparotomy for intestinal obstruction, also had a history of reflux esophagitis and plantar fasciitis. We said he decreased how much exercise he could do at times. He had COVID, which had been managed at home, and he was vaccine boosted when seen. So when seen, there was a painful upper and lower back that had been on and off for some months and was worse this last weeks. There was poor sleep and fatigue. He said because of the backache, he didn't really sleep well. And in terms of assessment, there was use of added sugars, a lot of processed grains, meat, dairy, together with mostly starchy veggies as opposed to green leafy veggies. And he ate about 1 cup green leafy veggies and 1 teaspoon daily. Physical activity was insufficiently active and he always felt fatigue. Sleep was not restful and he suffered from backache. He occasionally drank 1 or 2 glasses red wine, had never smoked or used drugs, and he felt stressed. He was starting a new business. He was, however, socially connected with his family and church. So as I said, the BMI was 39.4, BP 118 over 65, past 59, HbA1c was 6. And the results were not available. So from the assessment and, just outlining what may have been his risk factors and about the pillars of lifestyle, he was ready to commit to taking charge of the nutrition and exercise. He was at that time in the contemplation stage, but felt confident that he felt he had lost weight before. He had tried with intermittent fasting and he felt he had lost weight then, and he felt that he could lose weight. He was keen to try the lifestyle medicine, predominantly whole plant-based path. So the interventions were to increase the green leafy vegetables to 3 cups per day, 2 to 3 fruits per day, sometimes more. He stopped added sugars, processed meat, and other processed food. He reduced his bread, sugary foods, soft drinks, and even the fruit juices that he'd been consuming. He ate mainly
Thanks.
whole grains. Yeah, sorry.
Yeah, sorry. I don't want to interrupt you. Sorry there, Dr. Samba, but I
Yeah.
think let's just sink in this presentation. So we're having
Yes.
a gentleman who's in his middle ages and still now looking forward to starting up a new career. And he's coming at a really, I think, important time, I would say, where he's sitting at the stage where he's not in a he'd be more like a metabolic syndrome. He's not an overt diabetes and he doesn't have high blood pressure, but he's got this risk factor of being overweight and or being obese actually. And what I really like about what you did and what really is the highlight of lifestyle medicine is that you looked at these somewhat very medical conditions, right? Like pre-diabetes and obesity. And you were able to quite readily find things within his lifestyle that could be contributing to these conditions, even before they lead into seriously clinically significant chronic diseases. So, of note, I thought was quite interesting was that you asked him about his exercise and were able to recognize that previous symptoms that he has of plantar fasciitis led to less exercise, which is always fair to give people that opportunity. And you also then highlighted that his diet was not ideal, but again in your assessment you highlighted something readiness to change, and that he was feeling that he felt ready and confident to make changes in his diet. But you also said that he was in the contemplation stage of 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 his readiness to change. So, Dr. Samba, for those of us that haven't done the lifestyle medicine diploma and would really like to have an understanding of behavioral change, would you like to maybe explain how different stages of change are relevant and how a person's readiness to change is important in terms of how you introduce interventions?
Yes. Okay. Thank you so much for that. Sorry that I was going too fast. Yes. So really, if they are still very, very early on, and we just give that information, and they're not really ready to start to make any changes, then we just leave them there. But oh dear, now I'm realizing that I can't remember exactly that sequence. Can we just pause here a bit? Okay, so you asked about these different stages. Okay, so in the pre-contemplation, there is no intention or wanting to change the behavior. So we can only just offer the information and, just do a follow-up visit and hope that things might have changed at the follow-up visit. But at the contemplation, the patient, the person is actually aware of the problem, and even though they may not have made a particular commitment to action that particular day, but the awareness is something that we have planted a seed, and they can begin to be ready to make some little changes, as would be in the preparation stage, where they are now ready to start making some specific changes, and we can guide them, like smart little goals of, what exactly that they may be able to do. And then action is when they are actually carrying out this behavior. And, things can go a bit fast, or they can go back and forth. And we have to note that maybe they can be in different stages of change for different aspects of different behaviors, because there can be many lifestyle behaviors that need adjustment, and they can be different stages. They can be more willing to change some and less willing to change others. It all just depends. And the maintenance is when they have been doing these changes now for some time, and maybe about 6 months or so. So it's really quite established. Relapse is maybe for whatever reason they may have fallen off again. Maybe circumstances have changed, whatever, and for whatever reason, maybe their support system isn't there anymore, and they've gone back to the old behavior. Yeah, and termination is usually when we've been on the road for some time, and it's become part of our life. It's become part of our lifestyle. It's become part of our DNA. So we don't want to change. We don't want to do anything different, which is what I feel about my way of eating, for instance. I think I'm in the termination stage. I don't know whether that clarified. Yeah.
I think that's the goal, hey? We all wish
Yeah.
to be there. So thanks, Dr.
Right.
Samba, for
Yeah.
clarifying that so nicely for us. So the stages of change are so important, because
Mm,
that's where lifestyle medicine interventions really start working, because it's meeting a
mm,
patient where they are, and we really are achieving
mm,
patient-centered care. So speaking
mm,
about patient-centered care, how did it
mm.
go with you and Mr. AD? What advice did you
Yes.
give him, and what advice did you all agree on for him to continue?
Yeah. Thank you.
Yeah,
Yeah.
thank you.
Okay. So yes, he was keen to try the predominantly whole plant-based diet, and he was ready to increase the green leafy veggies to 3 cups per day. He was eating like 1 or 2 cups per day. So just remembering that, with lifestyle medicine, it's all about uh, emphasizing what can be increased, instead of saying, don't eat this, don't eat whatever, it's, the positive part. What can you eat more of, rather than eat less
Yeah.
of that? Because the idea is that if we eat more of the green leafies and whole grains, etc., we'll crowd out that plate, so that even if we're eating the meat and the other things, maybe there'd be less amount of that. So I just like to emphasize that the message is a positive one of more, rather than of deprivation, and meeting somebody where they're at, even if it may not be the way we might have wanted things to go. He was happy to stop
Yeah.
sugar. Yes, you were saying something like that to me.
No, I say that's great. Crowd the plate out with vegetables. Let's not leave
Right.
any space for anything
Yeah.
else.
Yeah, yeah, yeah,
Yeah.
yeah, yeah. And having said that, when I've learned early that when I am offering this, I need to remind people that when they eat vegetables, if it's green leafy vegetables, they'll need to eat a lot of them to feel full, because it's not the same as when you're eating those other, because of the difference in the calorie density of the foods. So that
Always
this
good to eat
nutrient
more.
dense. Yes. Because when they come back and they say, I was eating vegetables and I was hungry, the first thing I asked is, how much did you eat? And usually they were eating very little because they're used to having to eat little less to lose weight. And it's not that
Yeah.
way when we're eating plants. So
Wow. Yeah.
there's a lot of chewing that has to take place, yeah. And he was happy to reduce the sugary food, the soft drinks, and even the fruit juices, and eat mainly whole grains, beans, lentils, fruits, and drink lots of water. So this is what he was happy to do in terms of the nutrition. And then he was happy to begin walking about 3 times a week for 30 to 60 minutes with the support of the physiotherapy for the plantar fasciitis. Also explained that, probably as the weight came down, that fasciitis would become better. But that, we should have the support of the physio because it wasn't about punishing the body, but doing what he felt comfortable to do and how much he felt comfortable to do. At that time, there was no accessible dietitian. And then he, on his own accord, opted to take a break from alcohol. And then at some stage, he was part of the group attending the shared medical appointments that we were running in the clinic. Okay. Yeah.
Wow, that's great. So I love, like you said, we went back to the original reason why he wasn't walking as much as you'd want to, and we supported him in the appropriate way. And also, one of the secondary benefits of weight loss will definitely be improvement in that plantar fasciitis. So I think that was great. Now, you mentioned here that you started attending shared medical appointments. So for those of us that don't know what shared medical appointments are, would you like to explain what that is first? Yeah.
Yeah. Thank you. Yeah, they're a great soul support that is used, maybe not even apart from lifestyle medicine in other countries, but even for other conditions, like maybe some psychological conditions where people who have maybe a similar health condition or a similar health goals, etc., they are brought together, and in the power, there is a dynamic and power in being in a group and in community. Of course, there has to be an understanding about privacy and confidentiality that has to be respected so that it's no personal details as such are going to be shared, but there can be some common things, some common themes that are running through that can benefit from them be shared in the group. In the way I did this particular shared medical appointments, I actually focused more on just introducing the lifestyle medicine pillars to patients I was seeing who were in high risk or who were already on chronic medications or high BMI, etc. And I found that each week I was repeating the same story to individuals. I was saying the same thing, like a broken record, each patient that was coming in. So I thought, okay, explaining the lab results, explaining markers of inflammation, explaining what was driving this, what could reduce this, the power of food, the power of physical activity. So I thought, okay, what about if we have shared medical appointments? And so I explained, they got their permission, they signed consents of confidentiality, and yeah, we were meeting as a group for about 1.5 hours. So we had a very interesting time. We went through, each of them had like baseline labs, and then we'd come back and then I'd have them look at the labs and in a simple way, just explain what was driving that total cholesterol, what was the LDL, what did that mean, what did the translators, what was an HbA1c, why was a creatinine and an EGFR important, and HB, just little basic things. And then another time we had the physio come in and just give a demonstration of the different types of physical activity, what was important about aerobic, what was important about strength training, and how much of it we needed. And, there was so much that we got to learn. And then, of course, more into the food, inflammations, and, lots of questions. And from the sharing, you could see aha moments going off. And you could see also people sharing their experience with different things from week to week. So that was very empowering. Yeah.
I love the word that you use, the empowering.
Yeah.
This kind of exposure is very empowering for people with chronic diseases. And so, it's a really, really demonstration, really good demonstration of what a shared medical appointment is. Um, did you see benefits in all your patients that attended shared medical appointments, or did you see it not working out for others? Did you have any pros and cons
Mm,
about this experience in Africa?
mm. Right, thank you. So what I noticed was that for those who attended and who did take time to try some of those suggested changes, they did notice, they would report that they felt better, even if it was just a little more energy, a little less achy. That's one of the things. There were some whose medications reduced, and then, yeah, and just you're just more motivated to take charge of their health. I think everybody benefited to the degree that they attended. Yeah.
That's so good. So let's go back to Mr. AD. So after his
Mm.
attendance at shared medical appointments, introducing a whole food plant-based diet, also reducing the amount of sugary beverages and meat intake. He also started brisk walking with the assistance of a physical therapist. And so Dr. Samba is going to let us know how his patient was doing after this intervention. How were his results after this intervention? And do you
Yeah,
have any
great.
reflections that you would like to share with us?
Yes, thank you. So post-intervention, the weight from 99.7, which is almost 100 kg, was now down to 90, which is, I was like, 10 kg loss. The VP
Yeah.
had been 1118/65. It was now 1111/78. The HbA1c, which had been 6, was now 5.6. And his BMI from 39.4, almost 40, was now 35.6.
Wow. I
So,
mean, sorry, before I interrupt you there, I just want to say something that highlights so much to me was that 10% of weight loss. If you could clarify the period of time, but 10%, any weight loss of more than 5% has got clinical significance in terms of outcomes such as blood pressure, diabetes, and cardiovascular disease. So, that kind of a weight loss is no small feat and definitely something to feel very proud of. Would you mind to tell us over how long
yes, I
this
think it was
result
about over
happened?
2 to 3 months, because I
Wow.
always emphasize that it's not about rapid, but slow, slow. Yeah, it was over 2 to 3 months. Yes. Yeah.
Wow, wow.
Yeah.
Simple adjustments, no need for any additional medication, but
Yeah.
also keeping very close eye on important medical markers. And it shows that a lifestyle medical medicine intervention at the
Mm,
right time could prevent
mm,
serious, serious
mm,
complications.
mm. Right. And
Any other
so,
reflections that you might want to share with us?
yeah, yes, please. So, he also felt less achy, less tired, less sore. Said he slept better and was
Wow.
and was less constipated.
It's a relief for everyone, eh? Sure, it made the back pain better.
Yeah. So they no longer needed to go to the physio. Yeah. So yeah, so this to just display the restorative potential of lifestyle medicine. Uh, while there is the evidence base for the 6 lifestyle medicine pillars, another point was important. The concept of eating predominantly whole plant nutrition, regular physical activity, restorative sleep, avoidance of risky substance, stress reduction, and social connectedness, Ubuntu, resonated with him as an older African man, because this was the traditional African way of living. And despite the weaknesses it may have had, it was protective against NCD. So he was able to see that actually, yes, this traditional African way of living does work. As a strongly anti-inflammatory lifestyle that he got through his whole plant-based nutrition, he experienced a relief from the aches and pains as he made the changes, and the weight loss normalized his HbA1c. And he reported that I sleep peacefully most days for over 8 hours. even though I do break for an hour or so to pray, but that doesn't disturbs me. It helps me a lot. And then he also said, I've learned to split tasks into manageable chunks, planning activities ahead of time, allowing myself some positivity, appreciating myself for something, listing what went well each day. So this was all the positive psychology, sharing with trusted people what I might be going through, planning ahead. I found these ease my stress and anxieties. Lifestyle can be managed and manageable if you put effort, and can be enjoyable and less stressful. So this really warmed my heart.
Oh, that is beautiful. Such true testimonials on how lifestyle medicine can not only just take you back to your roots, but also, like you say, a powerful anti-inflammatory way of living,
Yes.
and a true role to longevity. I'm sure Mr. AD can look forward to another 40 or 50 years still on this planet.
Yeah. Yeah.
Yeah. So thank you so much, Dr. Samba. That was really great. We are going to now move on to our next section. But for now, let's just say thank you again to you.
Thank you. Thanks for having me.
Yeah, la, la. All right, and we're back with our third segment of the SALMA Spotlight. My name is Dr. Dumi, and I am with Dr. Samba Nyirenda, double board certified lifestyle medicine diplomat and physician outside of Botswana. Today, she's going to be giving us her tips on the 6 pillars of lifestyle medicine that will improve your life right now. So, Dr. Samba, welcome. And let's get it started. Why don't you tell us about what tips you have for keeping healthy movement in your lifestyle?
Okay, thank you. So it can be daunting to get the 30 minutes 5 times a week in. So short moments, many times. So putting on some your favorite disco music when you're cooking, so that you're doing some disco moves as you cook, and making sure that your activity tracker is set on disco cardio or something. So it can record those steps and those moves. So that helps you feel good as well as get some movement in. So short moments many
Nice.
times makes a difference. Yeah, right.
Yeah, sounds like a good exercise snack. And then for sleep, what would you recommend for us to get a good night's sleep?
Yeah, great, great, great. Very, very, very important. Putting the cell phone on a silent sleep mode from a certain time each evening. Just telling yourself from this certain time, this phone, no notifications, no calls, whatever, unless, maybe some family or whatever. But otherwise, just giving yourself an off with that cell phone, and avoiding the blue lights and all this, the screens, and just clearing the mind and saying, it's time to sleep now. And uh, especially if you're in a new environment, traveling, etc., making use of a mask, because sometimes you may be in a place where there's so much light, you're not able to get that good restful sleep that you need. So these masks that you can say from the last time you traveled there and whatever, just put it on nicely there, and that will help you to get the kind of sleep that you need. Yeah.
Switch off the phone and switch off the lights, and then you'll get some real good sleep. That's awesome. And now, if we haven't slept, we tend to also struggle with a lot of stress. Do you have any simple stress hacks that we can use to manage our
Mhm.
stress?
Yes, yes. Yeah. Check out, explore different meditation practices. Make that, if possible, just a regular part of your life. It can be even a walking meditation, it can be sitting. And if you can just uh, do it in a regular way, like especially maybe in the morning before getting out of the house, just having that quiet moment and centering and being in the moment can make a big difference to how you navigate the day, as well as having like some regular check-ins, whether you're using an app, not using an app, but mentally through the day, maybe even between your patient encounters from one thing to another, grounding and saying, okay, where are my feet right now? What's going on? Not to analyze or not to judge, but just to be conscious and say, okay, I'm here now. Let me be here now in this moment, not my mind somewhere else while my body is here. So just getting little grounding practices, little meditation can make a big difference to stress management.
Being present, being aware, and mostly non-judgmental. That's the way to practice these daily trips. Well done. And then, so we've done sleep. And what advice would you give us for nutrition? We all want to know what to put in our mouths.
Lots of green leafy vegetables. So the moroho, the cabbage, carrots, peppers, chomolia, whatever is affordable, just pile those up, make those half of your plate, and then the other foods, if whatever they are, but just pile up on them, whether they are raw, whether they are cooked. But lots of green leafy vegetables, and of course you're also going to have your whole grains, as well as your starchy vegetables, your sweet potatoes, pumpkin, butternut, all this, and then your different kinds of beans and lentils, your different kind of beans that we have, and some of your nuts and seeds. Yeah, but just make that plate a whole fiber-filled a plate. Yeah, with lots of water.
So you're telling me I can eat lots of food as long as it's fiber?
High fiber, and most of it green leafy vegetables. Yes, it works.
I like how you talk. So will you tell me
Low
then,
fat,
about
low
what you've
fat.
told me, and low
Sorry,
fat.
low fat,
So
low
you've
fat.
low fat. So you've told me what I should be putting in my mouth. What about what we shouldn't? Please, can you tell us about how we can address risky behaviors such as drinking
Mm,
or taking
mm.
substances?
Yeah. An important thing is learning to be with our feelings. Most of the time, when we use those substances, it's because they help us to feel different, whether it's smoking, vaping, drinking, overeating, even overeating certain things, not overeating moroho, but usually overeating sugar, gambling, all those things. It's all about our feelings. So just learning to be with our feelings, learning to take care of ourselves, learning to feel, am I hungry? Am I angry? Am I lonely? Am I tired? What am I experiencing right now? How do I take care of myself right now? Whom do I need to reach out to? Do I need to rest? What do I need to do before we pick up that substance? And just, learning to share our feelings too.
Yeah, connect with your feelings before we connect with the wine glass. I think that that's very, very powerful. And speaking about connection, how else can we connect with each other in order to lead a better, healthier life?
You're right. So let's appreciate our friends, our families, and we have seen even the pets that even actually hearing other people's voices, seeing their faces is more powerful than just texting on WhatsApp. So if we can just have that positive contact, with loved ones and with supportive people, makes a big difference. And then being part of something bigger than ourselves in the community, maybe volunteering in a charity, being part of something at our church or our mosque or whatever, but being part of something more than just ourselves and our agenda, and just reaching out to others and connecting with others in positive ways. Yeah.
Right. Be part of something. Like we are a part of the South African Lifestyle Medicine Association, and that's why we decided to spotlight you today. People have learned something about how to put lifestyle medicine into their own lives and also how to include it into their patient lives. And I hope that you were stimulated by our very engaging case presentation. And we congratulate you for pioneering lifestyle medicine in Africa. We're very excited to hear how the progress goes with your Food for Life teaching, and that maybe we can all come over for some healthy eating very soon. So thank you so much for joining us today, and we really really appreciate your being here.
Yeah, you're so welcome. It's been quite a thrill, and the classes will be online in the future, so I will be sharing the link And, much appreciation to Salma, because it was Jan Taylor in Salma who got me connected to this lifestyle medicine certifications and all the family, etc. So I'm really, really grateful for Salma. That's why I think I'm a lifelong member of Salma.
Hallelujah to that. And
Yeah,
so I
because
hope we get more
you
people.
guys really got me started on this journey. So I forever appreciate that, and the wonderful work that you do, and even in helping in inviting Botswana to work in the co-accreditation curriculum of the BSLM, so that we've got one tailored to our part of the world. Very, very much appreciate you, Salma. Thank you again for having me. Thanks.
Thank you. I really hope that through lifestyle medicine, Africa can connect and reintroduce what we all know is traditional African ways of living into helping us fight these new challenges of non-communicable diseases in our lives. So thank you very much, and goodbye, everybody.